In 2001, the Clinic of Reproductive Medicine and Gynecology is a certified centre for fertility treatment based in the heart of Europe. The clinic is a well-respected institution in the Czech Republic.
So far we've had 17 treatments. We're due our 18th and probably final treatment this summer.
We would never find patients that were going through traditional fertility treatment, be it IVF or ICSI, that would go abroad. It is basically for those people that require an egg donor or possibly an egg and a sperm donor.
The simple fact is that the institutions which are providing treatment can't cope with the demand.
Several people that we spoke to had more than one pregnancy abroad, so they've actually gone back and done it again.
An increasing number of couples are travelling abroad to seek infertility treatment. It's described as one of the fastest growing areas of medical tourism, although that's a word none of those undertaking this journey like to use. Is it costing too much in terms of emotional, physical and financial stress?
76% have either been or would go abroad for treatment.
To date we've spent £90,000 on treatments.
It's clear that we're playing Russian roulette in starting to have our families in our 30s.
It should be the most natural thing in the world, starting your family when the time is right for you. But for thousands, it just doesn't happen. I'm BBC Scotland's health correspondent Eleanor Bradford, and today I'm asking why many childless people choose to take the overseas route to pregnancy, all of them driven by a desperate desire to have a baby. Dr. Richard Fleming, director of the Glasgow Centre for Reproductive Medicine, has no doubt why numbers are escalating. Women are starting their families later in life.
The age at first birth is now age 31, and it's been recognised amongst the scientific community for a long time now, but it seems to escape general knowledge that human fertility starts declining at age 31. So it's clear that we're playing Russian roulette in starting to have our families in our 30s, and a large proportion of our patients in fact are not starting to try until their mid-30s or late 30s. And by then the chances of natural conception are extremely low, and also you're running the risk where in fact towards the end of the 30s that IVF struggles to make up the shortfall.
So these patients need donor eggs, and because of extreme shortages in the UK, head overseas. For over 25 years, Dr. Francoise Shenfield of University College in London has been looking after people who are having trouble conceiving.
We know that people travel to different countries for different reasons. Some countries it's because the law is very strict. In the UK, the law is not strict at all. It's actually one of the broadest minded legislation in assisted reproduction in the whole of Europe and the whole world. You can have treatment if you're single, if you're in a same-sex couple, etc. The main reason is lack of access. In European countries, which are wealthy countries in general, whatever the economic crisis, our access to fertility treatment is much poorer than similar countries of similar economies. So when you look at comparison, we do, for instance, 50% less treatments than France. It's not because we are less subfertile than the French. It's because there is less national health access. And this is the main ethical question. It's a question of justice, equity and access to treatment. There is less than 50% of IVF cycles done in the National Health Service, and that really is totally unfair to all the people who can't afford to go privately.
So if the NHS doesn't offer more, is this why people go abroad for treatment? Dr. Shenfield is also a member of the European Society for Human Reproduction and Embryology, known as ESHRE.
For the British, it is very clear that the main reason they go abroad is lack of access and high prices. Lack of access means long waiting lists for certain specific treatment, and particularly this affects egg donation. And we haven't got enough egg donors, and you may be aware the HFU is actually looking into this very specific concern right now with a public consultation document. There's been discussions about how much donors are compensated for the 5 or 6 days which they give and all the intrusive activities they're submitted to before being able to donate their eggs.
An expert in her field, Dr. Shenfield recognises all the reasons why people seek treatment abroad in growing numbers. We've had access to a survey conducted by the Infertility Network, which supports anyone with a fertility problem. Their report produced some hard facts to back up those reasons. Gwenda Burns is Scottish coordinator and was surprised to find 76% would go abroad.
The main reasons for this was waiting times. 70.5% had said waiting times. 69.5% had said the cost of treatment. 61% had said the success rates. Although every country will be different in how those success rates are gathered, that information, 53.8% had said the availability of donor eggs and sperm, and 51% had actually said that they had went on a good report from someone else who had actually been abroad for treatment.
So the shortage of sperm and egg donations in the UK, which lead to very long waiting lists, makes patients look elsewhere and head for clinics abroad where they can receive much faster treatment. Dr. Richard Fleming of the Glasgow Centre for Reproductive Medicine.
The simplest answer is that in many of the places abroad there is a large supply of willing donors, probably because some payments are made to them. In most cases these are pretty modest payments, but it's sufficient to be an encouragement for these young women, usually in their mid-20s, to donate eggs. And there's also actually a culture in some parts of the world, Spain particularly, that this is very much encouraged. Donation of sperm is a more complex matter, and I'm not clear how many people are going abroad for donated sperm. It's much easier, or has been much easier, to import the sperm directly from abroad.
The Human Fertilisation and Embryology Authority, or HFEA, is the body which regulates all IVF and research using human embryos in the UK. Juliette Tizard, head of policy, agrees that availability of donors is a problem.
That does seem to be one of the principal drivers for people going abroad for treatment. I think sometimes people go abroad because they can get cheaper treatment. Sometimes they go abroad because they want to have a treatment that's not available here. But mostly it's about getting faster access to treatment, and that usually involves donor treatment. We've just finished a 3-month consultation on egg and sperm donation. And one of the questions that we really want to find an answer to really is, what are the contributing factors? Is it about how donors are treated, how they're recruited? Is it the expenses they're offered? Is it about just the fact that we operate in an environment where they will be traceable by the child who's born when that child gets to the age of 18?
Donors of gametes, or eggs and sperm, are not anonymous in the UK. That means your offspring can track down their biological parents when they turn 18. And the lack of anonymity for donors here seems to be one of the reasons behind the shortage of eggs and sperm. Going abroad for these means you and the donors can have that anonymity. Samantha McKish founded Cradle to support people like herself who needed help to start a family.
You can go abroad and still have anonymity, and that's your choice, but also that there's an abundance of services available, which unfortunately, removing donor anonymity, not that I was necessarily against that, dried up all of the donors here in the UK, and that's really what the problem was.
And it's a problem that's had repercussions for those seeking donor eggs and sperm, causing long waiting lists in the UK. Until April 2005, people donating sperm, eggs or embryos could remain anonymous. Realising that it mattered very much to some people, the government lifted donor anonymity, and now all those children conceived in this way can obtain identifying information from the HFEA when they reach the age of 18. Juliette Tizard of HFEA thinks lifting anonymity for donors was the right choice, but was it right for the recipients and their children?
I think some people go abroad for treatment because they want to have an anonymous donor, but that doesn't seem to be the case for most people going abroad. I think some patients regret the fact that they have a donor who their child can't have contact with. Some of them also regret the fact that they won't even be able to find out any biographical information or any information about other children that were born from the same donor.
But the donors themselves may have a different point of view. Dr. Raul Olivares is Clinical Director of Barcelona IVF.
The fact that the donor remains anonymous is also important, because working with really young donors makes more necessary to keep the anonymity because they don't know what they are going to be doing 10 years later.
Donors limit the number of families they want to donate to. And that I understand perfectly well. Because since 2095, you have to give your totally informed consent that in 18 years' time, the offspring may contact you. If you're an egg donor and you've made this very generous decision to be known to your offspring, you might decide to do it for 1 or 2 families, but you're not going to decide it in the great majority of cases for 10 families, which is the maximum in this country. And indeed, what we found in our studies is that some people prefer to have an anonymous donor.
Dr. Francoise Shenfield.